I think we have made good progress in prevention, secondary prevention, especially in terms of screening for cervical cancer, elimination of cervical cancer. That's where we are heading the right way, so vaccination, HPV vaccination, there's a lot of global action going on, and seems to be trickling down really well, permeating through many of the low and middle income countries, particularly Malaysia. So I think that's a win. That's a win that we see in cervical cancer space. And I also think generally there's more awareness among the public, general public, on cancer. In the past, people used to think that it's not my problem. But now, because they are seeing more and more people, and there are a lot of personal stories, like their friends, their family members being affected by cancer. So people are beginning to realize that it's everyone's problem. So I think that's also a big win. And it's happened in Malaysia, also in Southeast Asia and many other countries. And then when we talk about management, of course, we have a lot of new drugs. Not necessarily all of them are effective, but we have managed to improve access to drugs. But I wouldn't say that we have made a lot of progress, just a tiny bit. Because the reason why I'm saying that is it doesn't mean that when we have a lot of drugs introduced in the market, meaning that they are, number one, whether they are going to be really beneficial to patients in the way that the patients want it to be. And number two is, of course, access, whether they can afford to get those drugs, because not all of these drugs are readily or freely available or with subsidy for patients. So I think that place we need a lot of things to do. What we have not been successful, right, is providing supportive care and palliative care for people living with cancer. And I think this topic is so important in the low and middle income countries, because yes, it's really good to talk about prevention, early detection, talking about management, optimal treatment, and so on. But what do we do with people who are already diagnosed with cancer, be it in early stage or late stage? It's not just all about providing treatment to them or curative care, but it's also about giving them an opportunity to live well with cancer, and we have not done well in that area. During the pandemic, what happened is there was a lot of engagement between the government sectors and also the civil societies. It was all related to COVID. But we can use the same energy and the same success, how governments and how physicians, the healthcare professionals learn how to work with the civil societies. Why not do it with cancer? When we are talking about providing supportive care, it need not to come from physicians alone or nurses alone or from healthcare professionals. It can come from members of the community. And this is where I think we need to back up and use the lessons from COVID and try to do something better for the patients. We need to make sure that investments are also made in helping people to live better, not only physically, but also mentally and financially. And I think when we talk about financial well-being, when we help patients to be financially stable, financially well, and also enable them for those who are working to return to work, we are building the economy. It's like a ripple effect. It's not something that we only do for patients, but we are doing it for the entire communities and also for the country. So we should be investing more on patients, on things that matters to patients, on outcomes that matters to patients. So we need more, not only research, but we also need to have more implementation of interventions, testing of interventions that will help patients to achieve well-being beyond physical well-being.